Howdy, folks. This is Drew Farmer again, and we're going to address a topic that I didn't really expect to until somebody asked me about it. It's kind of contentious, but we're going to talk about Measure 110. Reason we're going to do that is on Friday I learned an update from a meeting I sit in. I learned it from three public entities and one provider service about the data collection methods that the state is engaging in right now. So for folks that aren't familiar, they're out of the state or they're in Oregon and they just haven't heard about it. Measure 110 was a measure that came about for the purpose of encouraging people to get into recovery from drugs and decriminalization, which isn't the same as legalization. However, what the impact is in practice is if you have under a certain amount of a substance on you, then you get a fine, $100 I think it was, or you can ask to go to recovery and they'll waive the fine. Now the problem with this is when the measure was passed, Oregon already had an excess of people that wanted to go to recovery. At least in my county they did, in Coos County. I think in the 7 years I had worked in or around mental health, we never had a deficit of people who wanted to get sober, that wanted to go to a recovery facility. So on that front, people were engaged, talked to about going into sobering. They were offered an opportunity to go into sobering, but there weren't beds. It could take months or longer, I had heard, to get a person into sobering. And again, obviously, there was a surplus of people that wanted to get sober. That wasn't a necessary component, but it was there. And in some places, there are models like this, and those models work when you've taken the appropriate steps. If you've got facilities built and then you engage folks to get into sobering, you've got somewhere to go if they want to get into recovery. In a state that has nothing, you've already got a problem. Oh, little buddy, I've got a cat named Filbert, and he would like to participate. Hi, buddy. So, buddy, you interrupted my thinking. What that does is, well, obvious. There's nowhere to send the folks. And the concept of using the funds to create additional units came about. The funds were taken from marijuana dollars that had been going to cities and counties, and those funds generally were allocated to public safety. So in my county, ours was allocated towards the interagency narcotics team, so a team that would go about pursuing the suppliers of drugs. What it meant when they started to cut into that was that we had less funding to go after the suppliers of drugs. So guess what happens? There's more drugs. And now those funds have gone to a program to encourage people to go into sobering when there's no sobering facility, there's no recovery facility. So you've got more drugs, so more people on drugs, probably, or just overdosing and dying, like has been the trend, um, and nowhere to send them to recover. But the program's saying that's what it's supposed to do. Well, that's probably not going to happen in that case, is it? We're starting to see some funding come out of it. However, I think it's been in play for 2 years. My community, to the best of my knowledge, is only starting to hear about it now, which makes sense because back in July of this year, 2023, the program implementer for the program resigned very publicly, citing the state mismanagement of funds. They had done a study, showed the person needed 35 staff to 45 staff. State gave them 7 and then acted surprised when it wasn't working. So they chose to leave and cited a bunch of other interpersonal reasons and just general stuff that would come across as toxic work environment, which is something we hear a lot about right now within state operations, unfortunately. There are a lot of good people up there, so it's sad to see. So the bad news I got, in addition to all that, that's news we already knew that was bad. Bad news we got is the way that data has been collected on the outcomes of Measure 110. We're starting to get news about how it was used, and yeah, it looks like a failed program, but it's achieved these things. It's got more people into recovery, it's got this, it's got that, it's got Filbert's attention. But The way the data has been collected, according to the agencies that were in the room, is they were required to provide their total agency data, total agency outcomes. Now, that isn't the same as what they've received Measure 110 funds for, is it? That when you don't know where the funds are going and you ask for people's data, and you take all that data and say, look at our outcomes, it's probably not the outcomes of the program, is it? It's the outcomes of the total agency. It shows that agencies are doing a good job, they're achieving something, but it doesn't necessarily tell you what Measure 110 did. And the reasoning we were oh, and I should clarify, in addition, agencies that did receive the funding were still required to provide their total agency data. So programs that had no interaction with Measure 110 still had to provide that data, and it's been reflected as the positive outcomes of Measure 110. And agencies that used part of the funds to assist people, the total outcome of the program, even if that was just paying for supplies or something, even if it was a fraction of a portion, 1% of that program, the entire program data gets reported. So, reasoning given. It's difficult to track the data on a single funding stream when you have the commingling of funding streams, which is true, it is a pain. But having run a community action agency before, where you have 104 funding streams, I can tell you the state wouldn't have any mercy on a community action agency if they couldn't tell them how the money was spent, and they couldn't demonstrate to what extent this funding stream impacted this program's outcomes. 104 funding streams. You need to be able to show what that money did and what that money did, not what your other money did. So I don't really buy the reasoning. I mean, I get that it's hard, but the cost of transparency is time. You're going to have to do it if you want to be accountable. And that was a concern a lot of people in the room had, is now how is that program going to be trusted? Even if it is having good outcomes, how are we going to trust it? Because the data is tainted. It's not pure data regarding the topic. So that's the quick update I wanted to provide for folks. I mean, the problems with it were apparent from the start. It had really low support. Well, actually, it had fairly good support. It just had really poor execution. There wasn't staging to provide for it to be successful, and based on that resignation that occurred in July, it's pretty clear that the state didn't help a lot to make it successful. And now with what's going on with the data, there's a big push to get the measure repealed, and I really don't see how it couldn't be at this point. It's been a fair amount of a failure, and the data that says it's good is data mingled with other programs. So I will see everyone later, because Filbert is demanding love. You take care.